Okay, so our topic is access to affordable healthcare, and we're gonna have a brief preview of it. So we're gonna start with experience. So the main group of people that are affected by not having healthcare are low-income communities, especially minority communities like Black, Native American, and Hispanic. Young people are also more greatly affected by not having healthcare. So here's some fun facts. 1 in 5 uninsured adults went without much needed medical care due to the cost of the care, and 28.5 million people don't have access to health care. 46% of people don't have health care because it is too expensive. Those are very shocking numbers. It's nearly half of our country. And let's just take a look at one of our um, little examples. So this is Anne, and Anne is an elderly woman who didn't have health care, and she was experiencing some medical issues. Her feet were turning black, but she put off going to the hospital, and it turned out to be a much more serious issue that she was going to have to deal with, all because she didn't have health care and she couldn't go to the doctor. So now we're going to talk about social analysis, like who is perpetuating this problem, and one of the social groups is the federal government. Right now, the federal government, the policy on healthcare is the Affordable Care Act, or Obamacare. And while this program has helped a lot of people and given a lot more people health insurance, as seen by these images, this those uninsured in 2010, and then here is a much less amount of people who are uninsured in 2015. And while Obamacare has helped, it has some drawbacks. Like if you liked your healthcare plan, you could. They said that you could keep it, but many people's healthcare plans were canceled, so they couldn't keep the healthcare that they wanted. And then another institution that is perpetuating the issue is
Okay. Another issue with that causes people to have problems getting health care is that the Affordable Care Act, or Obamacare, is a flawed system. Under the Affordable Care Act, small businesses do not have to give health care to their employees. Um, so it's a shocking number that 99% of all businesses in America are small businesses. So that is 99% of businesses in America that don't have to provide health care. This becomes an issue because people then have to go buy their own health care, because under the ACA it is illegal to not have health care. You'll be fined if you don't have the health care. So these people then have to go buy it on their own. Another issue is that the insurance companies are increasing their rates, so it's becoming more expensive to buy healthcare. Also, some of the healthcare providers saw premiums jump by 116%, and other providers are leaving the marketplace altogether for Obamacare. This leaves many people in situations where either their rates have increased, so now they struggle to pay for their insurance, or their deductibles are high and they can't afford to use their insurance, or they lose their insurance altogether because the providers pull out of the market. Um, Another issue is minimum wage. So this is an image that shows the minimum wage rates in the United States. Unfortunately, though, a lot of, or many states have rates at or below the federal level, which is 7.25 an hour. So a lot of people are making only 15,000 $15,000 a year, and that's not nearly enough to pay for living expenses and also buy health insurance. Um, so the step 3 is theological reflection, um, and the first Catholic social teaching is the dignity of work and the rights of workers. So, um, it the Catholic Church states that the rights of workers should be protected and respected, and workers have the right to a fair and decent wage, as well as the right to insurance. So the first quote is from Pope John Paul II, I believe. It says, "Besides wages, various social benefits intend to ensure the life and health of workers and their families play a part here. At expenses involved in healthcare, especially in the case of accidents at work, demand that medical assistance should be easily available for workers, and that, as far as possible, it should be cheap and even free of charge." Um, so, even though the ACA does have flaws, um, and changes needed to be made to make it accessible and affordable for all people, it does need to be taken into account that Obamacare, by removing Obamacare, might have also unjust um, results for people. So, when revising the ACA, all people and their health care should be taken into account.
The next CSC principle that we're going to talk about is rights and responsibilities. So basically, this is saying that the federal government or whoever is responsible has a responsibility to provide all people with healthcare, and that healthcare is a human right that cannot be denied. Um, so here's our first quote. Catholic teaching supports adequate and affordable healthcare for all because healthcare is a basic human right. Healthcare policy must protect human life and dignity, not threaten them, especially from the most voiceless and vulnerable. Healthcare laws must respect the conscience of providers, taxpayers, and others, not violate them. Coverage should be truly universal and should not be denied those in need because of their condition, age, where they come from, or when they arrive here. So just because like all people in the United States should have access to healthcare because it is a human right, no matter who they are, where they come from, what age they are. Yes. And this was just a fun little 10 commandments for healthcare that the network lobby for Catholic social justice teaching created. And just describes like what healthcare should entail for all people. And healthcare is not merely just providing people with access to a doctor, it's also making it affordable and easily accessible. Yes. So that's a right as a human that we have.
And then step 4 is the social action or response. So the ultimate goal for healthcare system would be to provide healthcare to everyone in the country at a reasonable cost. This, however, cannot be attained under the current healthcare insurance plan through Obamacare. An act of justice would be to get to the root of the institution in the federal government and to change the healthcare situation in the ACA. And petition should be made to form a new healthcare plan that fully protects the dignity and rights of the people. The closest thing that we have to this currently is President Trump, who is proposing a new healthcare plan. Unfortunately, his plan does not necessarily fix all of the issues and does not fall in line with the USCCB. But by proposing a new plan, it's taking the first step in an act of justice, which is to reform, noticing that there are issues and trying to reform them. As an act of charity, there is the Medicaid system, which doesn't eliminate the issue, but it does help the issue. It is a system that's federally and state funded, which provides medical insurance for low-income families and high-risk people. So the Medicaid system is more of an act of charity, but it does help these people who are struggling to afford health